anytime I have somebody at week 0 to 2, that's all we're going to focus on for the next 2 weeks, and I just continue updating that 2 weeks out. Hi everyone, welcome back to the podcast. Welcome all new listeners. Welcome back to those who've listened to my content in the past. It's Friday Eve that I'm recording this, and I'm excited to just share the week's progress, the topics, the discussion. And this week it was about groin strains. We had an athlete with with a decent groin strain, and we were trying to manage it and trying to see where the timelines were, and could we have expedited it? Can we expedite it? What would we have done in the past? What do we need to do moving forward? And I just thought I'd share that with the world, because I'm sure you have a lot of athletes, or will have a lot of athletes with this style of injury. Before I continue on, what is better? What is new in my planet, in my world? All good things. I've been if you guys don't know, I bounce back and forth between our satellite locations, and I spend my time really just supporting the growth of our team. And we're right now at the moment we're prepping for kind of our annual plan, like what we're going to be doing for the next year, and I'm really excited. So just working with a lot of the team members just on what needs to happen over the next quarter, over the next year, where is the growth going to happen, both personally and professionally, and that's kind of been the jam. So a lot of good topics. High level discussions about growth and professionally what needs to happen for them to take a next step. So that's good. My family's great. Kids are good. My son Jacob is a meatball at the moment. He's just growing, both sideways and long ways. So it's been good. All right, on to the topic. Groin strains. Here's what I have. We have an athlete several weeks out from a groin strain, grade 1, I'd say. And imagine you have an athlete from the start of an injury, day 1, and you now have to map out how soon can they get back to a multi-directional sport. Let's say soccer. For whatever reason, and they have a timeline to get back within 1 month, max 6 weeks. So if you know my style of progressions, I'm always going to work backwards. So if we want to work on 6 weeks out, we have to figure out what is going to happen at week 5, 4, 3, and 2, 1. So if 6 is return full throttle to sport, 5 is at least contact, multi-directional, 100%. 4 has to be modified practice, multi-directional, no contact. 3 has to be plyos and integration in linear running. 3 has to be, well, actually 4 has to be lateral integration. 3 has to be linear integration, and 2 has to be strength, and 1 has to be range of motion flexibility. So if you look at that timeline, it's a little tight, and not everybody's going to follow that exact same timeline. However, you kind of have to map that out before you even get into it. So when I asked a team member, I said, hey, what did you do at week 2, 3, 4, 5, 6? And we went through it, and definitely the progression was proper. However, I think a lot of times you have to create what I call bumpers, or precautions and contraindications, both on what you should and should not do. And I think as clinicians, we are really good at telling what people to do, like what you're allowing people to do. You need to do these 4 exercises. You need to stretch. You need to ice this so many times. You need to do such and such. And some people will say, okay, well, you don't need to stretch. Okay, great, sounds good. But in the context over the next 4 weeks, like, is that all the things I can't do? What can I do in soccer? What can I do at home? Can I jog? Can I be on the bike? Can I be on the elliptical? And you can't give people specific pieces of equipment. What you need to tell them is parameters that they can follow so that they can apply it to everything else. So you cannot move side to side. You cannot bend your hip past this degree. And then they have to put that in context of, well, I guess if running is that degree, I can't run. I guess I can go in the elliptical. I can maybe do the bike because that doesn't put my hip in that position. So, so you have to put those bumpers on. In the context of this athlete, we were at week 10, and we were wondering if there's still lingering things, where did we go wrong? So at weeks 1, 2, 3, and 4, what we realized were the bumpers needed to be a little tighter in terms of anytime I have somebody with a groin strain, the first thing I'm going to do is outline the first 2 weeks. First 2 weeks, they just need to know exactly what needs to happen, what they can't do. And they need to know in small segments. And that's like telling somebody, hey, I'm going to have you lose 12 pounds. So in 3 months from now, you're going to hit 12 pounds. And at 10 weeks, 9, 10, 11, this is what you're going to be doing. Like, they can't see that far. All they can see is, what do I need to do for this next week to change my lifestyle? And I know that's a little far from a groin strain, but it's the same context that some people can only digest small chunks, and that's what you're setting up with success with. So you can't go too far out. Just give them the outline. Hey, at week 10, 11, 12, this is what we're doing. However, that's pretty far. For the next week or two, these are the 3 things you're focusing on. So anytime I have somebody at week 0 to 2, that's all we're going to focus on for the next 2 weeks, and I just continue updating that 2 weeks out. So at day 48 to 72 hours, first thing I'm going to do, like whatever your philosophy is, if you like ice or rest or rice or whatever your methodology is, like just do that in the first 48 to 72 hours. I'm a big fan of rice, the rice principle. I think it's great. It works, and I'm not here to argue if I go blood flow or not, but I know that I'm just going to follow the methodology that I believe in for the next 48 to 72 hours. Just keep them moving. Don't aggravate it. That's the first thing you need to be focused on. From that 72 hours, the next thing we're going to be focusing on is range. Keep that thing going. Keep blood flow in. But here's the thing. Where can you minimize how much stress is going across that groin over the next 2 weeks? And one thing you can do that I'm a big fan of is add a compression wrap or a thigh sleeve. Depending on how high that groin strain is, put on the thigh sleeve. And all that does, and this is just temporary, right? This is just to get them through the first 2 weeks. All waking hours, apply that. And all you're doing at that point is you're minimizing the stress across the anchor or the origin or insertion point wherever the injury is. So if it's high in the pubic area, what you can do is apply a compression wrap, have that apply that pretty firm, or a sleeve, and now that takes pressure off the origin site where it's pulling on and giving pain. Now, very, very temporary. However, when we're talking about maximizing somebody's health and recovery, it's all the 1% or the 5% progress and all those things that are going to be helpful. So after we reviewed the case, that was one thing I would have thrown in. In the first 2 weeks, all waking hours, get that thing on there. Let it scar down just a little bit so you don't keep tugging at it. First 48 to 72 hours, make sure you apply the rice principle, get them nice and easy, just don't let them aggravate it. The next 2 weeks, thigh sleeve, don't let them aggravate it. Once they hit that 2 week mark, let's start exploring linearly. Now, my precautions and contraindications are, I don't want them going lateral against resistance, and I don't want them going into hip extension against resistance or for a long stride. And the reason I think that you're going to get more of a tug on that adductor and apply more stress. So I keep them at mid-range so they can bike like on a stationary bike. I think that's great. Keep them moving. They're going to take shorter strides, and I think that's important for them to know. So if you have shorter strides and you have a thigh sleeve, that's massive. There's less tug on that adductor. If you do that in the first 2 weeks, man, they're going to love you. They're going to be like, this thing feels amazing. And that's where it gets dangerous. I literally had a conversation with a client today saying, week 2, this is where the danger happens. Week 2 and week 4, that's where everything goes wrong because you're doing too good. And the reality is, I just set you up for success, but you didn't know what the next 2 weeks were going to look like. You can't just zoom out and take off. You're not ready yet. This at week 2 is where I'm going to start to do some modified closed chain, bridges, hip extensions, just to get them into that nice easy range, but they're not going high intensity and a lot of resistance. And then I'll start linear work at week 2, lateral work week 3, progress linear running week 3 going into 4, lateral jogging week 4, multidirectional 4 to 5, and then now you have contact to add on top of that. But in an ideal world, you also have to bridge in acceleration and deceleration. So it's a little tight timeline. And everything's going to progress based on how well your first 2 weeks went. If you take anything away from this podcast or this episode, The first 2 weeks are the most important because that's what would set you up for being able to get to week 4, 5, 6. If you went aggressive at week 2, all you're doing is you're just delaying their healing down the line. Week 2, take it easy. Don't mess it up. Week 2 to 4, start the strength work, return into linear running, lateral running. Weeks 5 and 6, multidirectional, return to sport. And at week 6, they should be 90% subjective report. Their personal rating of improvement should be 90% for them to get back to sport at some form or fashion. They need to be at 90%. If they're not 90%, they're not there yet, and I wouldn't put them in. At week 5, you can start to test them, like closer to that week 5, week 6, you can test them in like hop testing, vertical testing, and see how that aggravates them. You could, is it part of their sport? Is it that large of a demand? If they're a runner or a sprinter, you're definitely going to have to test those end ranges. If they're a soccer player, test that end range, anything applicable to them. So I would definitely test them if it's true to their sport. Do they need it? Sure, sounds good. At least you're giving them a little bit of insight into what that's going to be right when they return to sport. You risk injuring them. So I have to ask, how important is it for you to test them? I think they just need to have a general sense of what that's going to feel like. And if they still feel a little bit of a tug, they're not ready. And their subjective report should kind of go along the lines with that. And then you already know from that point on what to do. So 48 to 72 hours, RICE, 72 to 2 weeks. Wrap it up. Have a thigh sleeve, light range, flexibility, keep them moving. Maybe on the bike, whatever versions you want, whatever creative therapeutic exercises you think of, whatever you think is best. Week 2 to 4, linear, lateral. Week 5, 6, multidirectional, modified practice, get in there. And when you outline it like this, it's actually really straightforward. However, at weeks 1, if you try and tell an athlete that, hey, at week 5 we're going to be doing this, they won't wait that long. They can't see that far in the future. You just told them you're going to help them lose 12 pounds when they haven't even lost their first pound. So just create short-term goals. After reviewing our case as a team, that's where it went wrong. The bumpers weren't set, and we assumed that if we provided the full outline that was going to solve the case. It wasn't, and you have to give them short-term goals, and they have to be able to achieve those goals. And I think you have to treat your athletes and your patients and clients not like you. I think the problem is that you think like they're going to respond like you would, but the reality is when you are injured, when you're vulnerable, when you don't know the answer, you're going to be put in the same position. And I think we forget that. And when I am coaching and mentoring, that's the context that I'm trying to put everybody in the athlete's mindset. What is it that they're looking for? They just want guidance. They want to know, one, that they can trust you and they have confidence in what you're doing, that you know what to expect down the line, but that you're realistic in determining their goals and what that's going to look like. So you just chunk them every 2 weeks, chunk your goals, but let them know every 2 weeks kind of this is the next step, with the greater idea that at week 7, 8 you're full throttle return to sport. However, stop thinking like that. We're only going weeks 1, week 2 for the time being. So as you know, I'm not going to give you the exact exercise. I think that whatever you want to do, clamshell, sidestep, box jumps, box step ups, Bulgarian split squats. Now, the easy answer is if you already have the framework, 0 to 2, 2 to 4, 5 to 6, and we're talking about linear progressions, when would you throw that in? Now you're having, if you're doing like a Bulgarian split squat, where would you throw that in? Now you're adding hip extension with a little bit of just body weight load, maybe weeks 3 or 4. Probably closer to the 4 if you're going end range. If you're just doing box step ups on the injured leg is up, you're in high end or upper levels of range of motion in the hip flexion, so that might cause a little bit of irritation. So end range is both flexion and extension, might aggravate that. So I would put that in the later stages of probably week 4 as you're adding in plyos. You have to be careful. So if you say, okay, Chris, throw in, when would you do lateral lunges? Okay, so we said linear at week 3, lateral at week 4, probably at week 4. When would you throw in, let's say, ladder drills? Ladder drills, linear. You're not going full hip extension. You could go end of week 3 into week 4, and then you can see the same progressions. You can just literally insert your exercises. It's not about, is this the best exercise at week 3? What's the foundation of week 3? Linear. Okay, great. Everything in linear, and then start to touch on spreading out hip extension and hip flexion. So think about the range. If you're going lateral, start to increase the range. If you're now going to go linear running and plyos at week 4 to 5, then your priority is plyos and return to sport, less on the strength side. So this is the challenge that I see most PTs having. They want to throw magical exercises at every stage, the one they saw on YouTube or Instagram, and they thought that was the most creative. But what is the foundation of this phase? Linear progression and plyometrics. So at weeks 4 and 5, and you're counting ground contact times, and you're doing a return to sport. If you're doing 150 ground contacts or plyometrics in a week, you got to back off your fancy exercises because that's a lot of stress. So the foundation should have been at week 2 and 3 for strength, and now you're adding plyos and linear running, which is the foundation at week 4. Your progression turns into, instead of 3 sets of 15 at week 2, 3 sets of 10 at week 3, you're going to back off the exercise, increase your plyos. So now you're coming down maybe 3 sets of 5, 2 sets of 8. Your volume is lower because your priority now goes towards return to sport. And at 5 and 6, it's even less. Your exercises are more of a dynamic warm-up, a little bit of movement prep, and then now you're return to sport. So your exercises now start to drop. So weeks 0 to 2, you're in the protective mode. You're doing high levels, high volume of corrective exercise and a little bit of strength, and that's going to start to taper down at weeks 3 and 4 because now you're doing plyos and return to run, and at week 5, 6 you're doing conditioning to help them get back to sport, and then 5, 6 there should be a significant drop in all of their corrective exercises. And that's the way you have to think. Most PTs will think, what's the exercise I need to do today to make them feel better? But what you fail to realize is that if you look at the actual spectrum, at weeks 5 and 6 there should be very little exercises in terms of strength and endurance and everything else, because you're just focusing on what the priority is. And when you can chunk things into microcycles or mesocycles, that helps you create a better framework for, hey Chris, should I throw in this exercise? What week? Which phase are you on? Is a better way to phrase that. So if you're at one of my seminars, which I've been telling more people about this, I'm going to have one soon next year. If you're at one of my seminars and you say, hey, do you like this exercise? For what? At what phase? What injury? What body part? What's their focus? Are they multidirectional, linear athlete? What are they doing? Why are you doing this? Do they have an injury? How far out? Do they have a strength coach? Are they working with a technical coach? How many days of training do they have? And then you can fit it in context. And when you can see things that high up, and now you understand the framework that the athlete is actually asking you to do, that's when you are able to provide the best service possible. Because the funny thing is, when athletes come to you or patients come to you, they're going to come with the question that they know how to ask. But really what the question is behind that is, what should I do in this point of my training with this ache or pain? How many times a week? And then what should I do for the next 4 weeks after that to get back to returning? But they don't know how to frame that. They don't know how to ask that, because all they know is, what should I do about my ankle or my knee? And then it's your job behind the scenes to say, all right, tell me about your week. Tell me about your month. What's your training look like? How many days a week? What's your end goal? And then we'll work backwards, and then I'll answer your question. And once they do that, man, that's a great question. I train 5 days a week. I practice 3 days a week, and Saturday, Sundays are my rest days, and I have a game coming up in four weeks. Okay, great. If we work backwards, at week 3 you have to be back in the sport, maybe contact or modified practice. At week 2 you have to be able to run and sprint and cut. At week 1 we can start working on your range, soft tissue work, corrective exercise. So we only have a week to get you a little stronger, calm down your inflammation. At week 2 we got to get you back running. At week 3 we're cutting, moving, integrating back to practice, and then getting back to sport. So if you're asking me, is it possible? Yes. But you cannot flare it up over the next 2 weeks, because that's what's going to make it worse. So now we're talking about the context of a groin strain. Notice how you can insert any of the timelines with any injuries, and if you understand the timeline better, perfect. So this episode is about groin strains, but really it's more about heightening your framework so you can answer this. Now, if you say, Chris, what if it's a grade 2? Well, double your timeline. Now you're at week 12. There's one of my podcasts that talks about soft tissue healing guidelines and how I manage like my personal progressions and timelines. That's one of my favorite things to do on the planet is look at timelines. So if you have a grade 2, just now you're going at 12 weeks. So now you actually have to come backwards from my first phase of 6. Actually, it's really easy. You just double each timeline. So you ready for this? So if I said on a grade 1 groin strain, if week 5 is multidirectional and return to sport, double it. Now, if it's a grade 2, weeks 10, 11 are the same as week 5. And week 4, if we're saying lateral and linear progressions and plyos, is week 7 and 8. All you're doing is just doubling your progressions. So the framework is grade 1, double it. So now you have 4 weeks to calm down soft tissue, because we said from 0 to 2 weeks is the most important. Now the first 4 on a grade 2 is the most important. Don't flare it up. Phase 2 would be weeks 2 to 4, where you're going linear progressions, lateral progressions, and integration into running, which would be weeks 6 to 8, if I did my math right there. But nonetheless, I mean, I think that, you know, once you have this framework, it's amazing because you're unstoppable. Because really, it just like insert. You're almost asking people like, give me more. All right, give me an injury. Like, what do you have? MCL grade 1, perfect. That framework might change a little bit based on ligamentous healing. So if you want to go, normal would be like 4 to 6, but on a ligamentous injury, you might say 6 to 8, just because the delayed response and the difference in healing and the stress level. So you might just back it up just a little bit, but your timelines are still going to be the same. 0 to 2 to 3 for protective. You know, you're still protecting end range, knee flexion, extension. And then you're still doing linear progressions, lateral progressions, multidirectional running, modified practice. You're just doing the same darn thing. And so I know we're talking about groins, but you know, one of the coolest things is one of the first conversations I had was one of the team members, and we were talking about the exact same case. And I said, wait, I said, you're asking me about a groin strain, right? And I said, yeah. And I said, why won't you just throw on the thigh sleeve like we did with the hamstring a few months ago, or a previous athlete? And they're like, oh, it's the same thing. And I was like, yeah, but you just got mixed up with the like body part. It's the same. It's just the same injury. Whether if it's a ligamentous injury, they're going to be very, very classic, very traditional. You can plan it out. If it's a soft tissue injury, you can map that out. It's like replace bicep with quad, with gastroc, with groin. It's like it's the same. Don't ask me about a groin strain. Just tell me about the strain and what the timeline is, and then we can work backwards. And they just had this aha moment. So that is one of the coolest things on the planet, when you stop asking about regions and you start asking about timelines. Literally. Every injury is a little different, but the timelines stay very consistent, and that's where you need to put your framework. And I think that's what really puts you in a good place to service athletes, because any athlete can come at you and you're like, I got you. Whatever it is, I don't care if it's a neck strain or shoulder, or we had a shoulder dislocation, an athlete with a shoulder dislocation, and now we have to look at the timeline. It's not a shoulder dislocation, it's a timeline for an injury that we know how to manage. Now insert shoulder methodology and programming and go that way. So I hope that helps. I really think that just keep listening to the episodes. Like you'll hear the same foundational things over and over again, and it just like small changes just impact your professional career. And I think that because traditional CEU courses are very region specific, that's the framework that we go into in terms of managing people. But I think if you just take a step back and just look at timelines, then the regions are like, they're just simple. You can just insert whatever those CEU courses within the framework. So I hope that helps. All right, for those who have been asking, there's been people calling, texting, emailing, direct messaging, you name it. When is the course? What are we doing? All right, so the official date, I haven't even put this on to media or anything else. I just want to let you know. All right, here's what we have. This is one of the first places I'm launching it, and next I think I'm going to start emailing out, and then I'll put it on email after. And the reason is because my vision and goal is to help people through their professional career and really see it from a different lens, from the lens of an athlete, not just from a physical therapist. My view is as a healthcare provider, which encompasses a lot of things, which is having a better framework on nutrition, which is a better framework on having a greater scale look at strength and conditioning, not just being region specific or body specific, but being like body and athlete specific. So I'm trying to keep the courses smaller as of now. I might change that down the line just based on need. But the course, I think off the top of my head, don't quote me on this. You can also join my email list for those who you have entered in it. It's drchrisgarcia.com/mailing-list. Enter that, and then my course is going to be held. There's 2 courses in the spring. First course is going to be March 12th and 13th in San Diego at our new facility, Sports Performance San Diego. And then the barbell course, which is going to be launching soon, is going to be April 23rd and 24th. This is of 2021 for those who are hearing this replay maybe down the line. Those are the 2 courses. I do have 5 lined up for the year. I'll release them little by little, as I do with my athletes. I'm only going to chunk the first couple of ones. So March 12th, 13th, and then April 23rd, 24th. The first one's going to be a course on all the aspects of sports physical therapy in the context of the framework. It's going to be a 3-part series, 3 courses throughout the year to help you understand acute injuries, strength and conditioning principles, injury timelines, everything to help across the framework. If you haven't heard my podcast on CEU courses and which ones you should take, and I recommend, it's along a continuum from acute injury management to subacute to chronic to strength and conditioning, return to sport, plyometrics, working with coaches and strength conditions coaches to maintain or progress athletes all the way through the spectrum. And I think that most PTs, we only get the rehab specific and not the other edges of the framework. So the courses are going to be on both edges of that framework, and really just to put you in a better place to be able to see whatever athlete you want whenever, and whatever injury comes at you versus a 4-week chronic low back pain. That doesn't tell me much. So that's kind of what's happening. So I will send an email shortly, and you have more details on that. But if you're interested and you want to attend, I'm going to keep it semi-small, and it is only going to be, I think, 10 to 12 attendees at our new location, and opportunities just to hang out afterwards, and great social event, and really just hang out with really motivated, like-minded individuals that have been looking for something different outside of just the normal course about ankles. And this is really to give you a better framework. So I hope that helps. Start planning that out. If you need to buy tickets to San Diego, come join. It is our San Diego location near the airport. So there's a lot of hotels and everything nearby. There's a lot of good restaurants, and we're not too far from that. Whether that's any form of ride share company you want to use, they're all there and easy to access. So it's a Saturday, Sunday social event in the evening. And yeah, just a good time. So if you're interested, let me know. Send me an email as well, drchris@drchrisgarcia.com. If not, enjoy your weekend. I am off to the family and hanging out and eating some delicious food this weekend. So, all right, guys, happy holidays if I don't get to hear from you guys in the next few weeks. I hope you guys are doing amazing, and hopefully I see you in the spring. Okay, March 12th and 13th of 2021. All right, take care, guys. Bye.